to give us your intervention and your speech. You're welcome. Thank you.
All right, thank you very much, Emeka. Your Excellency, the Executive Governor of Imo State, distinguished Senator Ukwuije, the Honorable Minister of State for Health, Chief Emeka Wajuba, Professor Maurice Iwu, the Chair of IEDI, other panelists, my brothers and sisters from Imo State, distinguished ladies and gentlemen. Very quickly, I'm going to speak with you this morning about investment in health. And I hope my slide is up right now.
Yes, it is.
Okay, so specifically, I will be speaking to Imo State post-COVID-19 recovery and growth, a huge opportunity in social health insurance. You are aware, and everyone in the world would say health is wealth. And this is seen in Southeast Asia, in many countries of the world where health has been prioritized, and infant mortality and maternal mortality rates have been reduced. It has been seen to stimulate economic growth in terms of GNI per capita. And this has been seen in China, South Korea, Malaysia, and Thailand. But we know, as it is today, that COVID-19 has caused key disruption in the Nigerian health sector and indeed our economy. And these are key timelines in the COVID-19 pandemic in the whole world, culminating in Nigeria recording over 600 new confirmed cases yesterday, 17 July. And as at today, we have over 35,454 total cases with over 772 deaths. In Imo State particularly, we have 436 confirmed cases, and about, again, 9 of them have died. So indeed, it is a very big issue in the whole world, in Nigeria and Imo State. But it has also caused significant shift in access to essential health services. And I take some of them very quickly. This data is from the Federal Ministry of Health. So reduction in immunization coverage. So for fully immunized children under 1 year, we harvested data for 2019 and 2020. So you will see from the national picture that it has actually reduced completely. The next is Imo. And I have compared Imo with some other states like Lagos, Delta State, and Anambra State. And you see that there are significant reductions in immunization coverage in all of these states. Again, I also brought this data from antenatal care. These are primary health care, essential primary health care services. You find that there are significant reduction from the national, again, in Imo State, and in those 3 states that I decided to compare with. And the thought I wanted to bring out is outpatient attendance. What this means is that our people are no more accessing health services the way they should. So for outpatient services to be reduced this much, again, that shows us what COVID-19 has done in the health sector. But we know that health system strengthening holds the key to achieving universal health coverage. Imo is yet to be on track, even pre-COVID-19. And I'll show you a few slides. And this is coverage on health insurance. This is from a household survey we conducted in Imo State not long ago. We found that a coverage on health insurance in Imo State is just 1.7% of the population. Imo has a population of over 5.6 million. And then again, because that coverage on health insurance is very, very abysmally low, there is very high resultant out-of-pocket expenditure on health at 92%. The standard is not supposed to be more than 40%. It's actually 30%, 30 to 40%. But in Imo State, 92% of our population access health services out of pocket. So you can see that health is predominantly financed by households out of pocket. And again, you can see in both outpatient and inpatient services. So outpatient is 92%, while inpatient is also 92%. And then over 68% of Imo households have catastrophic spending. What this means is the number of persons, the percentage of the population that fall into poverty each time they are sick and access health care. The bad news is that most of them don't even get to access health care because they do not have the means. At 68.6% of people in Imo State falling into poverty when they access health care, this is very unacceptable. And I dare say that this is the highest in the whole country. This is not the kind of data I am proud of as a citizen of Imo State, but unfortunately I produced it, and this is, they say data does not lie. So we need to do something very critically, and I'm very happy that executive governor and team have promised and they are working on getting this. And will you also be proud to see a primary healthcare center in Imo State like this? I visited one quite recently just before the lockdown. And this is what you will see within a primary healthcare center where women deliver, where immunization is given to our children. This is not befitting of our state, and that is not what we want to see moving forward. But the good news is that Imo can build back faster and better. And we can do this through efficient and adaptive investment in health through health insurance. But if I have to illustrate very quickly how health insurance works, this is a situation where there is no insurance. This is Imo State as of today, where everybody is on his or her own. But we know that you can start some form of contribution. So the kind of things that happen in Akawo or those kind of schemes. So you get some people in various areas congregate and contribute, but this is also not sustainable. What is sustainable is social health insurance, where we have everything together, and this is the true Onyagala one there that our Igbos, especially Nimai, Ejmanai. So health insurance is in our DNA. We are already doing that, and we need to continue. The extent to which when you are sick, you go to the health facility, you don't need to pay anything because either you have paid or someone has paid for you if you're not able to pay. So you access health services and then you go home and smile and then live longer. But I'm going to tell you that Imo is not starting from the scratch. So the Imo State Health Insurance Agency was established in 2018 with the support from the World Health Organization, with a whole lot of groundwork that was done, a lot of assessments that were done to put it on a very strong pedestal. And this is in place as of today. We need to just turn the knob and make it functional for the good of our people. And just like my fellow panelists have mentioned, it is not just government that will do this. Again, a lot of us are already doing this in our various ways, in the very small ways, but it can be more sustainable. This was an initiative from my family foundation, Felix and Agnes Ukwuije Foundation, that has adopted over 122 persons from Amachara Asa community. And they are already accessing services. You can see this very, very cheerful and happy woman here displaying her card that was given to her by the Imo State Health Insurance Agency. They accredited the health facility in my community, and as of today, as we speak, these people are accessing healthcare without having to pay out of pocket. And this is just at 12,000 naira per person. This is very cheap. And again, for me, it is good cost saving for some of us who bear a lot of burden from our community members, from our family members and relatives that you need to pay very hugely on. 12,000 naira for 1 year for one person is good savings for anyone who even understands business. But we have even made it very easier with support from the WHO, with funding from the European Union. So we are starting an innovation that will be the first in Africa, just like Emeka had mentioned, and it's starting from Imo State. So there is the Imo State mobile health insurance that seeks to bring health insurance the closest to our people, even those living in the rural areas. This is in the works right now, and hopefully very soon the executive governor will have to launch this so that people will have access to it. But it has 2 or 3 barrels. So the first barrel is it brings it close to people. Anybody who can use mobile phone will be able to register seamlessly, hassle-free, on health insurance and even pay through the mobile phone. And the second is that it also brings it closer to those who would wish to adopt but are not close. For instance, if you are staying in the United States, in the UK, in Australia, in China, and you want to adopt people from your communities, you just need to click the buttons to do this, and you pay from there. And the Imo State Health Insurance scheme is credited, and then they start the needful. This is an unprecedented innovation that we are starting in Imo State, and I know everyone will have to key into it. But again, I have to say, lastly, that this innovation will also create additional jobs. One of the ways you can pay is using health insurance vouchers. And these vouchers will have to be sold by people even in the rural areas. The same way you sell vouchers for mobile phones. This is the way this can create jobs. And I'm going to show you in the ensuing slides how much jobs this can create in our economy. And I align completely with the vision, the 3 R's vision of the executive governor, especially in the creation of the 500,000 jobs. But I will show you that even this initiative in health insurance will create much more jobs than the executive governor has planned. But another good news is that over 75.4% of our people are even willing to engage in insurance, and that the disease burden is not very the things that are out of the way. They are the normal ailments that you see, malaria mainly, which is over 50% of all that we have here, typhoid fever and other infections. So why should IMO prioritize insurance for investment during and post-COVID-19 outbreak? I'll show you a few slides. And we try to do an investment case for health after running a fiscal space analysis. So we know IMO does not have money, but IMO can generate much more money from health than we have thought. Unfortunately, when my brother Emeka spoke about areas where we can stimulate the economy, he did not mention health. But I can show you in these few slides that IMO holds the promise to stimulate more domestic funding into our economy in Imo State. And we control for increased insurance as a share of the total health expenditure from 1.7 now to 51.4 in 2030. And then, of course, increase in donor funding, which is quite insignificant, an increased share of government schemes of the total health expenditure from 7 today to 8.6 by 2030. And most importantly, reduction in out-of-pocket expenditure from 92.3 today to 40% by 2030. And this is what you will find. So in this slide, and for me, this is the most important slide I'm going to show today. This slide shows us the gains, the returns on investment in both health indices, health state, and then in the economy. And I don't want to talk more about the health state because it will be a given that if you invest this much, you are going to improve the health state. I'm going to be talking about the economy because that's the remit of our discussion today, that in real GDP in billions, if we continue the way we are in 2030, we can only change or we can only increase the economy by 5.9 billion in 2030. But if we invest in health insurance, we are going to stimulate the economy and generate over 21 billion from the health sector using insurance. And I go down to total employment and job creation. Again, if we continue the way we are today in 2030, we can only increase job creation by 1.5 million. But again, if we invest successfully in health insurance, we are going to be stimulating over 5.5 million jobs, which is much more than we are talking about today. And we can interrogate this and go further in the discussions later on. But again, the investment in health insurance does not only give us those goodies in terms of economy and GDP growth, but again, it gives good promise on the recovery of essential primary healthcare services. And I give examples. That was why I was deliberate in choosing these states, these three states, to compare with Imo State and the national. So what you are going to be seeing in these slides, for those who are seeing it, is that even though all the states had a drop on essential health services during this COVID-19, you can see that there is early recovery in states like Lagos, states like Delta, and states like Anambra. These are states that have started even baby steps. I wouldn't even say that they have done so much in health insurance, but the three of them have one thing in common. They have started baby steps in providing essential health services and investing in health insurance. The next, and I'm going to be closing very shortly. So the next is on the same antenatal care visit. If you also see the three states, they are consistent. When you compare that with Imo, you will see that Imo is lagging behind. So in essential antenatal care, the three states are also showing signs of very early recovery. And in fact, Delta didn't even have much issues and much drop on antenatal visits because it is the most advanced in health insurance in the whole country. And if you look at outpatient attendance, in fact, you see Delta again soaring very high. Delta didn't even drop at all. In fact, this for me is the best slide I'm showing you today in terms of essential PHC services. Delta did not drop at all because it has a functional health insurance scheme. So what are we talking about here? We are taking away a few things. Number one, that the future looks very bright for Imo State, even though COVID-19 is devastating the country, but it provides a rare opportunity to do things differently. And we can turn everything around. These challenges, we can turn them around for good, as opportunities for economic growth. In terms of prioritizing state ownership of emergency response, including surveillance and early diagnosis, and increasing the health workforce in terms of well-trained and motivated health workforce. Our health personnel always go on strike because they are not well paid. But we can do better and bring them closer to development. And of course, a clear case for strong public-private partnership has been mentioned by other panelists here, because we know government cannot do this alone, and even the private sector cannot do it alone. It's only a strong partnership by both that can make it happen. And we suggest that health insurance can bring all of these things together and ensure that we prevent poverty and increase economic growth. This is my very, very final slides. So functional Imo State Health Insurance Scheme guarantees post-COVID-19 multiplier effect on economy through increase in health-specific resources. And here, we are looking at contributions from those who can pay. And this is, like I said earlier, only 12,000 Naira for a whole year to access health services when you need it, without having to break the bank. So we know today that a lot of people sell lands to be able to afford health services. This cannot happen again if we continue. And the worst thing that happens is, even when they are sick, they don't go, but they only go because they don't have money. They only go when it becomes worse, and a lot of them die. And when they die, they sell land again to be buried. So the second is increase in health budget and releases to reflect Abuja declaration of not less than 15% of the budget of the state to health. And again, releasing the equity fund for health insurance as we have in the health insurance, Imo State health insurance law, of not less than 1% of the consolidated revenue fund. But again, there is another opportunity in the basic healthcare provision fund of the federal government which the state will also benefit from. And then, of course, from development assistance, just like WHO is bringing to the fore, no lines are here. So if we position ourselves well, the development partners will come. So WHO is already here and partnering with the state to move to the next levels. And efficiency gains through strategic purchasing of health services, in strengthening primary health care and reducing the cost and waste that we have, and of course, creating healthy competition. We know that we have recommended that IMO should open their health village, because we know that IMO is the next health tourism hub of the whole of Nigeria. We have that potential and we can make it happen. And we know that the state government will listen kindly to this and make it happen. And of course, in the improved macroeconomic conditions, like I mentioned earlier, in terms of GDP growth and collateral intersectoral leverage and linkages, in terms of resource mobilization for the other sectors, and stimulating local production, especially in health commodities, including drugs. We can produce drugs in Imo State, and then PPEs as is needed, even this time of COVID-19. On a very final note, we do not expect that families should have to choose between paying for health care and paying for the other things they need, it's just like education or food. So we think that it will be very responsible for us as individuals and collectively as government to stimulate these investments in health so that our people will have good respite. My disclaimer here is that the issues I have raised here are my own thoughts, and the recommendations I made are based on my expert views. It doesn't in any way reflect the official views of the World Health Organization that I work for. And all the data I have used have been appropriately acknowledged.
Thank you very much. Thank you so much, Dr. Francis.